Hello students, today's demonstration is about the Benedict test. All of you know this is the most commonly asked test in the examination. Benedict test can be there in the spotting for the 1 mark, identify the test and give its use. So it is a Benedict test which is done for detection of reducing sugar. This is qualitative as well as quantitative test, that's why it is known as semi-quantitative test. Depending upon the color form, you can tell about the approximate amount of glucose or approximate amount of sugar, reducing sugar present in the urine sample. This is a bedside test in patient with diabetes mellitus. Now this test is replaced by the dipstick method, but this is still done in the laboratory, Benedict's test. Okay. So the Benedict reagent, this is the Benedict reagent which is having the sodium citrate, copper sulfate and sodium carbonate. So these are the composition of Benedict reagent. Now Benedict test, it is done for detection of reducing sugar in the urine sample. So this is also a point of care testing, near patient testing for the patient with diabetes mellitus. In patient with diabetes mellitus and in some hyperactivity of pituitary, thyroid and adrenal gland, the reducing sugars, particularly glucose concentration, increases in the blood and it crosses the renal threshold. The renal threshold is 180 mg per deciliter and it appears in the urine and it is detected by this Benedict test. This is based on the reducing property. In hot alkaline medium, sugar forms NADol, reducing sugar form NADol, and this NADol reduces cupric ion to the cuprous ion and there is formation of cuprous oxide which gives this brick red precipitate. Now see, for this test we take the 5 ml of Benedict reagent approximately, this is qualitative test, take 5 ml of Benedict reagent in the test tube and to this 5 ml of Benedict reagent add few drops. If you are doing this for the quantitative or semi-quantitative purpose, just measure the 5 ml of the Benedict reagent and add 8 drops of urine sample. So 8 drops of urine sample for the semi-quantitative test. Okay, and boil for 1 to 2 minutes. Boil for 1 to 2 minutes and observe the color change. It is GYOR, green, yellow, orange, red and brick red precipitate. Depending upon the color form, it indicates the presence of, means quantity of, approximate quantity of reducing sugar present in a sample, urine sample. Green, GYOR, 0.5 gram percent, 1 gram percent, 1.5 gram percent and 2 gram percent. If it is brick red, it is more than 2 gram percent. See the change in color. Now it is green. Now it is moving towards yellow, then orange, then red and brick red. So boil for 1 to 2 minutes and observe the color change. You will observe the brick red precipitate if the reducing sugar concentration is more than 2 gram percent. This is a Benedict test which is done for the reducing sugar. It is bedside test for detection of reducing sugar in patient with diabetes mellitus or when there is increase in the glucose level in patient with the diabetes mellitus. See the brick red color, it indicates the sugar level, reducing sugar more than 2 gram percent. Now see, this is, if you want to do the control, see this is with the distilled water, no change will be there in this solution. So this is, you can do as a control, okay, by adding the distilled water, 8 drops of distilled water. थोड़ा सा मूव करना पड़ेगा, नहीं तो टेस्ट ट्यूब नीचे से बर्स्ट हो जाएगी. एंड सेकंड, पॉइंट दिस माउथ ऑफ द टेस्ट ट्यूब टूवर्ड्स योर एनिमी, ऐसा मत करना. सी दिस brick red precipitate indicates the reducing sugar concentration more than 2 gram percent. This is negative Benedict test, bedside test in patient with diabetes mellitus. What are the composition of Benedict reagent? Sodium citrate, sodium carbonate and copper sulfate. Copper sulfate will provide the copper ions and because of the reducing property, sugar forms NADol in hot alkaline medium. This reduces the cupric ions to the cuprous ions, and cuprous oxide formation is there, which gives the brick red precipitate. This is the semi-quantitative test. क्यों बोलते हैं? क्योंकि depending upon the color changes, green, yellow, orange, red, brick red, you can tell about the approximate amount of sugar present in the urine sample. So this is a Benedict test. It is one of the tests for the abnormal component of the urine. One of the 6 abnormal component of the urine. The glucose is there or the reducing sugar is there. So this is all about the Benedict test. Thank you very much all of you. Thank you.